was like, I'm spending so much on my product, I didn't realize that I wasn't getting nearly as much of the actives as I thought I was.
Welcome back to Vital Skin Essentials. I'm Lorena.
And I'm Emma.
And today we are going to be talking about the Environ skincare line. This is a South African line that focuses on vitamin A, vitamin C, but in a really cool step-up process. So what that means is they have certain levels of dosage of vitamin A or vitamin C, and they start you off low so we can prevent any irritation from the skin. As most people know or don't know, vitamin A is, or retinol is a derivative of vitamin A. It's just a much more concentrated version. So if you immediately go into any kind of high concentration of vitamin A, you get irritation, flakiness, dryness in the skin. And that's what this line will try to prevent. So I would say, let's start with a little bit about benefits of vitamin A.
Yes. So this line was created by Dr. Fernandes, who is a plastic surgeon. He's from South Africa, and the sun is very intense there. So he really focused a lot on the importance of vitamin A, not only in retinol or retin-A form, but in the encapsulated version. So there's versions that are encapsulated in oil, and so the skin doesn't see them as a threat. They take them deep into this, the skin pulls them in. So you get long-lasting benefits. You don't get as much irritation, and you actually get like a 20% SPF or the equivalent to a 20% SPF sun protection, because the sun actually sucks out our vitamin A stores, not only from our skin, but our blood levels go down as well. And one key marker of our skin as we age is that the vitamin A levels go down as we age. So it's vitally important for keeping our skin youthful and protected. It not only protects our skin from the sun, but it actually protects our DNA from getting damaged. And
it strengthens the skin barrier.
It strengthens the skin barrier. It helps prevent transepidermal water loss. It helps even out the complexion of the skin. And it's vitally important for really every skin process. We think about hyperpigmentation, leatheriness, cancer, but it's also just the degradation of collagen, the laxity. It just causes a whole host of problems, and so many people are scared of it because they were maybe prescribed Retin-A or went on Accutane when they were younger and just got so dry, so irritated that they've stayed away from it. But it's very important, so it's important we get everyone on it, and the best way to do it is in this step-up program, because no one will have negative consequences to using it, and so they'll continue to use it, and they'll continue to get higher and higher and higher and see the benefits of it.
And in addition to the things that she mentioned, UV protection, strengthening the skin barrier, natural moisturizing factor, it's also great to stimulate and produce elasticity and elastin and collagen in your skin. So all of these things in vitamin A, which is why they focus on vitamin A and vitamin C, of course.
Yes, which you also need for collagen.
Exactly. So let's talk a little bit about the main lines. There's 3 main lines. The most common is going to be the Skin Essentia one, and as you can see, it is color coded to be yellow. I'm sorry, not yellow, orange. Orange. So the orange line is more for sensitive skin, someone who has more redness in their skin, a little bit more youthful skin, so late teen to early 30s. The reason I say that is because you start at the level 1, which is low dose. Again, you don't want anything too active for someone who has sensitive skin. Then you get up to, after a couple of bottles of level 1, you go up to level 2. After a couple of bottles of level 2, you go to level 3. Level 3 is going to be a high dose still, like a medium dose, but it incorporates peptides. So in the first 2 levels, you don't really get peptides, just so that your skin acclimates to even any kind of activity from the vitamin A. And it helps strengthen your vitamin A receptors. And those receptors are for you to be able to actually even penetrate or take in that vitamin A and find it useful for your skin. Other than that, if you go from level, if you even start at level 3 or level 4, your receptors are not stable enough or strong enough to even absorb, and it will cause irritation. So they want you to strengthen those receptors first. So once you get to level 3, you start to incorporate peptides. And then after level 4, you have a higher dose. Level 5 is going to be the highest dose that you have, and the highest dose that your skin can even be able to absorb vitamin A. However, I use a mixture of the lines, but some people just stay on one. We also have this line to be a little bit more hydrating. They have like a gel cleanser, or they have a creamy cleanser. They have a moisturizing toner. They have an eye cream that's going to be more for, again, youthful skin. Then it has the blue line. The blue line is the Youth Essentia.
Yes, and so this is going to be for probably 35 and older. And this focuses on making your skin more youthful. Everything is a bit stronger, just effective,
concentrated,
more concentrated, and more hydrating. So the cleanser is more hydrating. The Vitapeptide toner is just packed with peptides. It goes really well with the roller that we'll go over later. And then there's the Vitapeptide eye gel, which I have right here. And this has neurorelaxing peptides in it. This goes really well with the little stamp that we'll talk about later.
Yeah, it's part of the roller collection.
Yes, part of the roller collection that helps the target certain areas and penetrate product more deeply. And then there's the Defense Cream and the Defense Cream Plus, which pair with the sequence. And the sequence is the same thing. It's 1, 2, 3, 4, and 4 plus. And they weren't able to, do you want to go over it, or do you want me to, they weren't able to pack all of the ingredients into one tube. They were originally going to do that. But vitamin C is very unstable. Vitamin A is very unstable. They're very hard to, and then peptides are difficult too. So they were able to get vitamin A, vitamin C, and peptides all in one, but they couldn't also get all the other peptides, moisturizing factors, vitamin B. And so they separated them out, and you use them together. You can use them like separately or mix them together in your hand, because you're going to still get really good penetration.
I would do together just because nobody has time for 13
No one has
steps.
time. Yeah, just pump, 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 pump. Apply it face, neck, décolleté, of course. And so you go up slowly, and each bottle takes you about 3 months. So this is a very slow process. You're doing like about half a year on each number. And then once you get to 4 plus, instead of pairing it with Defense Cream, you pair it with Defense Cream Plus. And this is the only time you use Defense Cream Plus is pairing it with 4 plus. So the pluses go together.
Right.
And you never want to throw it in early. You don't want to be like, oh, I just want, I'm on number 1, but I'm going to go for Defense Cream Plus. It's not going to be a good idea. It's probably just going to cause irritation. Like, why not just wait? And then once you go to 4 plus, you can just stay on that indefinitely, and you can add in a retinol because that is going to be a different form of vitamin A. And so the more versions, different types of vitamin A that you use, the better, because you're going to have like different types of protection, and your skin's going to take in them in different ways and utilize them in different ways.
Right. And just to be clear, she's referring to 2 separate moisturizers. It's the Defense Cream and then the Defense Cream Plus.
Yes.
And she's saying don't use the Defense Cream Plus before going through the step-up process of the sequence serums.
Yes. And it's it's spelled out. You can't miss it. It's not like a little plus sign. It's PLUS on the bottle.
Yeah, exactly.
And it's more expensive too, because as we go up in potency, the price goes up, which is understandable, and also gives people a good option to spend less if they're not able to spend more, and still get a good product. Maybe not as many actives, but still a good product. So it's very cost effective, user friendly,
for medical grade line.
Yeah. And like we said, color coded, which is
super
also helps it be an easy line to navigate. So do you want to talk a little bit about the rollers, which is kind of a
they're
cool line.
They come in handy, but they're actually better than, I would say. It's a must. It's a must. You must have it in order to get the more benefit from the products that you're using at home. It doesn't have to be this one, but if you have different products that you have at home that you use, like different serums, you definitely want to incorporate a roller. This is more of like a upgraded routine, but super helpful. And I'll tell you why. There are 3 different types of rollers. There's one roller for the full face like this. You can do neck and décolleté. They have tiny little micro needles. This one specifically, the gold roller one, because it's 24 karat gold, it is 0.2 millimeters. You have the ones that have a plastic handle. Those are 0.1 millimeters. So slight difference, but you still get the same benefit from them. And then you have a body roller. The body roller is a lot bigger in size, obviously, because it's going to be great for the body if you cover more ground. The benefit of our rollers, I forgot to mention the small one. There's actually then 4.
Oh, there are 4.
2 face ones. One is just gold, just for
they're all on here.
Yeah, just for presentation. The gold roller looks better on your countertop. That's why I have it. The one with the plastic handle, you can easily, use it, and if it won't hurt as much if you break it or drop it.
Yeah,
you can replace it.
Won't hurt your heart.
Yeah, this one's like I think this is like $300.
It's $300, but also gold is antimicrobial.
Yes, it is, and anti-inflammatory. I believe, yes. And the plastic roller is only $100, so it's up to you. Same benefit. On top of the body roller, there's also a focus roller, and it's a tiny little stamp. Actually, not a roller, it's a stamp. Basically, you hold it, and then it has a circular top, and it has little needles, and that's more for like focus areas around the eye, around the lip contour here, and even like right here. I think would be super beneficial.
Or scar would be good
exactly.
For a scar
too. Yeah, some people. Yeah, you're right. So the benefit of the roller is that you get about 80% more product penetration than the regular 2 to 3% product that you normally absorb without the roller. So again, you're getting more benefit from the products that you're using.
Yeah, which is huge. So keep it in mind. I always tell people if they're not using the slime, they're just getting the roller, I'll be like, if you use Retin or something, just be very cautious. Something with a really high absorbency anyways, you want to be careful using it with a roller,
right?
Because it's going to give you so much but it's also good instead of like going up in potency. If you're like working your way up the product line, you can just use the roller and get more
so if you're right, because let's say you've never used this line before, slowly ease into it, maybe establish a good routine first before incorporating the roller, just to see how your skin reacts with just the skincare only penetrating like 2 to 3%. So start with that, then later incorporate. Again, the roller is just an upgrade routine.
It's wonderful because our skin is so good at protecting us that I was shocked when I saw that study, because I didn't realize that there was I'm spending so much on my products. I didn't realize that I wasn't getting nearly as much of the actives as I thought I was.
Right.
So this is, these needles aren't deep enough to penetrate collagen themselves, but they're just irrigating our skin, and it makes a huge difference.
Right. And it doesn't hurt. They're super
no
small
pain.
Needles, nothing. Just you don't want to apply too much pressure when you're rolling. Just gently glide it on the skin, and you want to make sure you're properly cleansing the instrument. It comes with a cylinder tube. The tube is great for you to keep because the plastic rollers have the bottom of the container that it slowly goes inward like this to hold the roller in place so that the needles never touch the bottom of the actual container that it comes with. On top of that, the cylinder container that it comes in has a little line where it tells you where you can fill up to with a cleaning solution. And you want to use the actual cleaning solution that comes with it, just because those ingredients won't tarnish the gears that are inside that is actually doing the rolling. So you don't want those to rust if you're using something with essential oils or anything like that. Even that, you don't want to use any essential oils when you're cleaning and then applying those essential oils to the face. It can cause breakouts. Yeah, it cause breakouts, irritation.
Yeah, and if it's not rolling properly, it could tear your skin.
Exactly.
Just take good care of it. And if something happens to it, just replace it.
Replace it. Again, if it falls, if it gets rusty, if you leave it damp, replace the needles. You don't want to cause more harm to your skin.
Yes. And so then do you want to go over the acne line next?
So then we have the acne line. It's the Cebu line, the Cebu wash here. This one, I only have a travel size, so I do travel with these. This one's made for acneic skin. It comes in the wash, the toner, the spot treatment, and the clarifying mask. The wash smells really good if you like tea tree oil.
Yes.
It has tea tree oil and it has salicylic acid. So if you have an allergy to aspirin, you can't do any salicylic acid anyway. But these are really great for face. I use these also when I travel on as a body wash because I overdo it on the sunscreen. I reapply my sunscreen, and these help purify my skin and decongest the skin that I have after like a lot of buildup. I highly recommend this if you struggle or even people who have like back acne. I recommend this to keep it in the shower, like the bigger size bottle, and use that as a body wash every now and then.
That's a wonderful tip. I think the spot treatment too for this line, even if you don't have acne prone skin but you get like monthly breakouts, I think that spot treatment is the best for hormonal breakouts. It really works well.
Right, because when you have the hormonal breakout, it's like one or two every, you don't have to have a full face of acne to use the line. So again, it is color coded. This one is purple. The acne line is purple. The sensitive line is orange, and then you have the blue line that's more for anti-aging focus.
And we might have gone over this already, but the orange line actually can be harmful for the oily acneic skin types because it has so much vitamin E in it. So just to keep that
that's why there's a separate line for specifically. You don't want to have acneic skin and use this line.
Yeah, you don't want to mix and match.
Or the blue one. Yeah, exactly. So stick to the clarity line, which is the purple line. So now that we've gone over the three main line that Environ has, we are going to talk about the focus care. The focus care is more of a targeted, specific concern. So
kind of like Biologique has.
Right.
The targeted serums.
Exactly. So these are Environ's targeted focus serums or product. So once you've already established either a routine with the sensitive skin one or the mature skin one, once you've established that routine with those, you can slowly incorporate other things that you want to target or focus on your skin. So let's say anti-aging is your target. Once you've established a line with either one of these lines, you have the option of like a exfoliating toner that's more exfoliation, like for thicker skin.
Oh yes, they have a glycolic toner.
They have a glycolic toner,
which is wonderful because glycolic acid is the smallest, so it's going to be pretty strong.
Very tingly, especially if you have like a little sensitivity in the skin, but you can still use it. They have a really good one. It's one of my favorite things from their focus care line, the Revival Mask. The Revival Mask has 3 different types of acids in here, so it's pretty active. You don't want to leave it on the skin for too long for the first time that you use it. It's got this really nice hygienic pump.
Love that pump.
It comes with a brush, so it's really, really cool that they do that.
And then you just...
Exactly, so you don't get your dirty fingers. And the Revival Mask is great to threaten the skin, to stimulate those growth factors, stimulate that collagen in the skin. It has a nice like lifting and firming effect on the skin as well. One of the pro tips that we know about is once you've acclimated, really you want to use this every night for 3 months. You want to use it about 15 to 20 minutes and then remove. Do that for 3 months. After that, you can start to sleep in it. You can add a couple of pumps of this mask, 1 pump of retinol, and 1 little oil capsule.
And those are so cute. They come in like a big jar of them.
They look like little pearl balls.
They remind me of those old like little, remember those bath balls or those bath beads? They used to sell like these like beads. Maybe you're too young. Like they're just like oil, and you. I always ask my mom for them. And you like put them in the bath, and then once they dissolve, the oil goes in the bath.
Like a bath bomb, then.
kind of,
but it's oil.
But it was just they look like that, but a little bigger, like
okay.
kind of like a jelly coating.
That's nice.
With oil
No,
inside.
I don't think I'm not familiar with those, but it's a great little pro tip because you wake up, your skin is flawless, glass skin, barely any pores. Yeah.
Glazed
donut, exactly. But again, you want to work your way up to using that overnight.
Yes.
To avoid irritation.
Yeah, because I think we both talked about the fact that we didn't know these had retinol in them in the beginning because it's not like right on the
packaging.
Packaging, so
it's
just
be
aware.
In the form of what is it in the form of?
I think it's retinol. The form of retinol.
Yeah, actual retinol. Yep. So just be cautious of those. A couple other things of your favorites.
Yes. So this night serum, I'm actually using this. I should have brought my full size one, but it helps to reduce the cortisol levels in the skin, which is really cool. And that's been something that has been talked about a lot lately, and it just you notice it in like hollowing of the temples and just laxity and just tired looking skin, dullness. You see it with anyone who works a lot, doesn't sleep a lot, this accelerated aging.
You're gonna need that tonight.
And yes, just like how much can I use? But it's really nice. It's kind of like an aloe vera consistency.
Yeah.
Just very
it has like a
light
bluish tint to it. And you mentioned you wanted to bring your full size bottle because
you can see through. Like this one's blue, but it's the full size one's see through, and you can see all the blue.
It's cool.
Gel in it. It's really cool, and it just absorbs really nicely. It feels just cooling, soothing. And I also have a client who has children, is building a new business, and had more stress than normal. Had some breakouts that she doesn't normally have. And I was like, I don't want to just like dry out your skin with the spot treatment. I don't think it's necessary. And she was up for trying this, and it got rid of her breakouts, and she hasn't had any since. Wow. So she has repurchased this. It does just great for her skin, which is really cool because it's not advertised as a breakout solution, but it makes sense because high cortisol levels cause havoc to our hormones and our sleep, and as a result cause us to have breakouts.
Like a weakened immune barrier almost.
Yeah. And then, because when our cortisol's high, we're in like fight or flight mode, and we can't repair.
Exactly. So next, from the same Focus Care Youth line, they have their retinols. They actually have two now. This is a old version of it. They just reformulated it to where there's only two types of retinols, retinol and then retinol Forte. So again, this is once you have already established a routine with this line, so that this doesn't cause any irritation to your skin. The retinol, again, is more of an advanced step, and it's an advanced way to treat that cell regeneration, which is great for anti-aging, great for even like the texture in your skin. It's amazing. Great anti-aging product. So you want to, again, make sure you are already on the routine before incorporating this. I say probably till you get to like a level 4 or 5, then probably start incorporating your retinol.
Yes, I love it. I'm using the Forte.
I have not used it
now, and I like it. It's good. Like it's a good strength. Like it's strong enough that I feel like it's doing some good work, but it's not causing any irritation. And I have acclimated my skin to it.
Disclaimer though, if you don't know about retinol is only used for nighttime. You don't want to really use it with another exfoliator. You don't want to use it with vitamin C at the same time. You can use vitamin C in the morning, retinol at night, but just in case if you're watching and you don't really have a clue about retinol, it's only for nighttime.
Yes. Retinol is an alcohol basis, not encapsulated in oil like
the other products.
Like the retinol.
So it'll just create more sensitivity to the skin if you use it during the day, which will cause pigmentation, unfortunately, that you don't want.
And also the sun just degrades it, so you're losing your money.
Exactly.
And then there's also the frown serum, or the anti-frown serum. No, it's just called frown serum. So you can use this everywhere, but it's mainly intended for the forehead area. And you can use it here. It wasn't originally intended for this area, but I would use it here. I haven't used it yet, but I'm going to get it because I'm noticing a lot of, I haven't gotten Botox. I'm having a lot of movement in my forehead. I'm just going to just,
or if you want to prevent,
pile it on. You can use
roll. You use your roller. And
yeah, you can use that preventatively too, or in addition to Botox to kind of stretch out the time in between getting your Botox injections. But it has the key ingredient or like superhero ingredient in the product is it's SN and then a little A symbol KE, which is a lab created snake peptide. It's a neural relaxing peptide, so it helps
snake
to
venom, right?
relax your
that's awesome.
Relax
that's
your
really cool,
wrinkles.
actually.
It's really cool.
Yeah,
and it's based on a certain. I don't remember the actual I don't know breed of snake. It's based on a specific snake.
Yeah,
but yeah, it's really cool. And there's another product that also has this magical ingredient that is $2,000. So this is a deal at only $186.
Yeah.
Yes. But yeah, really cool.
I think that's
product.
the
people that it's a no-brainer. The people that I've sold this to repurchase it, so that speaks for itself.
Next, we have the 3D filler cream from again the same burgundy color Focus Youth line. The 3D filler cream is more for loss of volume in the face, especially people who have gone on Ozempic and lost that mass and that fat of their skin, causing them to look a lot older than they should. That's what the 3D filler cream is for. Also, people who have had their buccal fat removed from their cheeks to create that nice little hollowed look. Again, it causes you to age a little bit faster or look like you've aged a little bit faster. So that 3D filler cream is great to re-establish the volume loss in the face. So great serum. It's more creamier than a serum would be. So you put it on top of your water-based serums.
And it is called a cream, which is a little deceiving. I've had a lot of people think it's a cream, but it's not a moisturizer.
The texture and consistency is a cream, but it is technically a serum. And it's also pretty hydrating. I've tried it on myself, and it's actually pretty hydrating. But again, you still want to add some moisturizer and SPF after using that.
Yes, absolutely.
I think that's all I can think of for the Focus.
I think that's all the Focus products. And then we have body.
We have body, but we also have our Moisture Plus.
Oh, yes.
We have the Focus Care Moisture Plus. We already talked about the hydrating capsules. We also have the Super Moisturizer. This is a great moisturizer, either alone or in addition to needing just a little bit more moisture. The Defense Cream and the AVST, they're both lightweight. They have these airless pumps. So really anytime you have a pump, it's more lightweight hydration. Great for summertime, whatever the case may be. But let's say you're into winter now. You still want to use your Defense Cream or you still want to use your AVST. You add a little bit of this Super Moisturizer on top, or if you want to mix it in together, it's a great occlusive moisturizer. So it really just seals in that moisture. Again, that's why it's part of their Focus Care Moisture Plus. It's a great addition to your routine. Again, you can use it alone or in addition to it.
And I love the ingredients in this product, and I really wanted to love it, but I honestly,
It's like vegetable oil or something.
I feel like it's not that not that hydrating.
Really?
Like personally, Defense Cream is more hydrating for me. Maybe just because it's soaked in.
Because of the molecular level is so low.
Yeah, but I'm sure that's not the case for everyone. Just like we always talk about skincare, don't do what your girlfriend does. It's different for everyone. It really is.
Yeah. Well, I'm going to try it because I just bought it. So
yeah, I'm curious to see what you
I would probably still do the oil over if you feel like you need a little bit more moisture. So probably for her, the oil would be better. I have naturally oily skin, so I think this one will probably be better for me.
Yeah.
But I do have both, and I do use both.
And then there's a serum, a hydrating serum well, which is like a gel, kind of similar to the night serum.
Gel base.
It's a gel base.
It's a high concentration of hyaluronic acid.
And that I honestly don't like that much.
Really?
It's sticky to me, but
like tacky a little?
It's a little tacky.
So when I've used serums like that, I have sprayed a little bit of like oxygen spray on my face or like a little spritz, and then I apply it and it alleviates that tackiness. So maybe try that. But that's a really good one. It has like a plumping effect to the skin because of that hyaluronic acid.
I could probably use it at night. I just, during the day, especially if I'm putting a little makeup on over it, or like, like a blush stick or something. I hate a sticky finish.
No, I like a sticky finish.
I like an oily finish.
Yeah,
Yeah.
the glow.
Mm-hmm.
But those are part of the moisture plus. Then we
Mm-hmm.
have, if you want to talk about
Oh yes, and
the
then we
Radiance.
have the Radiance line, the Mela Even.
Mm-hmm.
So this is wonderful for any pigmentation, but it's really geared towards melasma,
Mm-hmm.
which is the most difficult pigmentation. It's something that a lot of times we just kind of avoid because it is so difficult to treat. But this is for your client who has melasma, who is very compliant, and you believe that they're going to use it as recommended. Okay, so it's in a series. So you first apply the Mela Prep lotion. You can do it as a spot treatment or all over, depending on where your pigmentation is. And then you apply serums A and B. They come together in a box. Yeah. And then the Mela Even cream on top, and then your either ABST or defense cream, whatever you're using on top of that. And then if it's day, of course, your SPF. Very, very, very important.
Even on a cloudy day.
Even on a cloudy day, even if you're working inside in the basement. No, that's extreme. But if you're working inside, next to a window, still use it. Another thing to be aware of is that it's not just sunlight, it's heat that really is a trigger for melasma. So it's not going to matter if you're doing this really diligently, if you are going to your hot yoga, going to the sauna, even though those have good health benefits, it's going to trigger your melasma and just you're wasting your money and your time. Yeah. So just for the time being, at least, best to eliminate those activities and just really focus on using these day and night as they're recommended. If melasma is not a big issue, you just want a good stable vitamin C, a little brightening, something to stimulate collagen. You can just use this by itself. It's wonderful. Yes. I have a lot of clients that absolutely love this. And
that's the Radiance line.
Yeah, that's the Radiance line. And I'll include some before and after pictures in here because they are really impressive. Again, I think it's almost a year of someone being very compliant. So just really stress that to your clients because people with melasma have been disappointed over and over and over again. And you just have to really stress the importance of getting the whole line because if they just get this, it's not going to be enough for their melasma.
I think in certain cases they actually have a kit. It might just be for the holidays or
where they just sell it all
together.
It should be sold all together. I mean, well, except I guess this should be sold separately also because people do get it separately.
Yeah. I think, again, if you have melasma, you should probably get the little kit that comes with everything in it. So I think that's a great addition to your melasma journey.
So next we have the body care to talk about, which is one of our favorites.
We have about 2, 3, 4 things, really 5 things. So we have the Dermalac lotion, which is lactic acid. It's exfoliating. And then you pair that equal parts with the vitamin A, C, and E body oil. And so both of those together is great for that hydration, the elasticity, that leathery skin, the pigmentation even. I actually remember using it several times a day when I had to use it on my clients. And I had a couple of scars on my hand, and I don't even know which hand it was anymore. I can't even see them. And these were, of course, they were like more like superficial, like cuts and scrapes every now and then from bumping into things. And so I mean they're gone. I don't see them anywhere on my hands.
Oh, that's wonderful.
Yeah, so I love that product for that reason. This is something that I use from head to toe. Well, not really in my face, but you can apparently use the body oil on the face because it has vitamin A, C, and E in it. So it doesn't congest the skin. Personally, I wouldn't use it. I just have oily skin.
And E can congest the skin.
Exactly.
Some people,
which is why I don't use it on my face, but disclaimer to you. The body oil mixed with the Dermalac lotion, they don't create that greasy, stick to the sheets feeling because of the lactic acid. It actually allows the oil to penetrate a lot deeper into the skin. And so you're just much more hydrated and moisturized. Like I use it typically after the shower while my skin's a little bit of damp still.
Same.
So I get more hydration from it because that oil seals in that moisture. And then on top of that, You can use the contouring cream, which is specifically made for fat cell reduction. Yes, fat cell reduction. So great for, what were you saying your trouble zone in your leg was?
The whole thigh.
So
I put it on. I use it every night, and I use it on the whole thigh and glute because my legs are my trouble area. Like, I've always hated my legs, and this helps them be less jiggly. They just look a little bit like firmer too. Like, I just have very thin skin, so any fat I have on my legs does not look good. It shows up. I have really light skin too. And I'm always skeptical about products. So at first I was like, yeah, I don't know, like, stop using it, and I noticed the difference when I stopped using it. So I'm sure there's a longer lasting fat reduction effect, but what I noticed was an instant firming effect, which is wonderful and magical. And I like for summer is perfect.
And that was without the roller, right?
That was without the roller.
The body roller. So the body roller, I remember if I mentioned it. It was like the bigger size one.
I think you mentioned it earlier, but I don't think you mentioned it in regards like when we were talking about the body products.
So she used it without the body roller, and how we mentioned before, the roller is actually better for penetration, like about 80% better for penetration. So that was topically not using the roller. I can only imagine how much more benefit you would get from using the body roller, using the Dermalac lotion with a body oil, with a contouring cream. Then we have from the body cream as well, or for the body line, the hand and nail cream. Really, it's non-greasy, great travel buddy.
Good on your cuticles.
Good on the cuticles, exactly, to maintain that moisture. For us who wash our hands constantly, I don't want to always throw away a good, expensive moisturizer. This is pretty non-expensive, and it hydrates the skin. And
it's small, you can travel with it.
It's like 1.69 fluid ounce. So travel friendly. Keep it in the purse, especially if you wash your hands constantly as well.
And then the Dermalac, did you go over the KP?
Oh, I didn't know.
The Dermalac is also really wonderful for keratosis pilaris. Most people get in the backs of their arms. You can also get it on your thighs, where I used to have it. But it's just overproduction of keratin. Some people are more prone to it than others.
Me.
And it plugs the hair follicles. It looks kind of like chicken skin or goosebumps. It can be red. It doesn't really cause that much discomfort. It's more just, it's unsightly, and like, it just makes you uncomfortable to have it. So if you use it every night, you get out of the shower, you apply it. You don't necessarily have to use the oil with it, although it would help because it's good to hydrate your skin. But that will get rid of it. It will come back if you stop using it, but if you use that regularly, it will diminish it, and that is wonderful news for people with KB, because that can be also a very frustrating skin issue.
Yeah.
I think that all.
Oh, they do have a Comfort Plus line where it's like the targeted for that sensitivity in the skin. They have a really nice colostrum serum.
Yes.
It's more of like a dusty rose color, color coded. And basically they have an anti-pollution mask, which is this one right here, very soothing, and basically anti-pollution, meaning like dull and devitalized skin.
Smoker.
If you live exactly in the city, or if you are around a smoker, not that you're a smoker, but if you live around a smoker in the city,
point to me.
This will be the extra step that you can incorporate into your routine. Either the mask, they have a little hydrating spritz, anti-pollution spritz. They also have the colostrum serum that I mentioned, has a little bit of lavender,
just to cover up the bad smell,
because it is cow based, but great growth factors in the skin, so great anti-aging.
And since they're naturally derived growth factors, you don't have, like, if you are a recovered cancer patient, you don't have to worry about these growth factors making things grow that you don't want to grow, because it is naturally derived. You don't get that risk with it.
Right, exactly. And it does smell pretty nice, and
it smells wonderful
on the skin.
Yeah.
I think
it's also a little sticky.
Yeah.
But if you use it at night, it works great. So I just suck it up. I do use that.
You do. That one, I would say, has a short shelf life. So use it morning and night. I think it's a 6 months.
6 months after you open it.
After you open it, correct.
Yeah. So if it starts to run out, you just like use it on your
body.
Use it everywhere.
Yeah, exactly. I don't think it's pretty expensive anyway, but still, it's a great
Yeah,
line
it's not
for
horribly expensive.
yeah. The price point for this line is amazing. Given the again, it's certified by the Swiss Vitamin Institute, so very great line. I love the line. All of these products are mine, so
that
tells
proves
you
it.
that tells you something. Oh, I think that covers Environ.
Yes.
Thank you so much for tuning in.
Thank you.
If you all have any questions, Emma and I are typically the ones answering this question. So feel free to ask any questions. If you need any recommendations, feel free to let us know.
If we don't reply right away, we will reply to you.
And eventually we will reply at some point. Yes.
Thank you for watching.
See you next time.
Bye.